A petition calling for the exemption of hospitals from the country's rolling blackouts has garnered hundreds of supportive signatures. Soon after being launched, the Charlotte Maxeke Johannesburg Academic Hospital has been under severe strain as services are tremendously hindered amid crippling power outages. The hospital says emergency surgeries have suffered numerous delays and that the prolonged blackouts were damaging to sensitive medical equipment and therefore threatening lives. This as the number of admissions and severity of the disease has increased exponentially since COVID-19 restrictions were lifted. Joining us now to explain the severity of the problem and how it can be avoided is Charlotte Maxeke, Johannesburg Academic Hospital Head of Internal Medicine, Professor Adam Mohamed. Professor Mohamed, good evening and thank you very much for your time and for joining us tonight. Explain to us the strain that a rolling blackout of 4 hours, maybe at a time, could have on a hospital like Charlotte Maxeke.
Good evening and thank you for highlighting this issue. So it's firstly one episode of 4 hours, and now when load shedding numbers increase 5, 6, then you're getting a second episode. So if you look at the critical care areas, these have backup batteries. But we know the more load shedding you have, the more redundancy or weakness that occurs in these batteries, and the lifespan of these batteries are limited, and replacement of these batteries are a challenge from lots of different companies. And currently we are busy trying to redo all the defibrillator machines because you can't even get supply stocks for these batteries. So across the hospital, numerous pieces of equipment have backup batteries but are under stress and pressure. UPSs for CT scans, sonar machines, computers are all under immense pressure. What does that detail down to the patient level?
Yeah.
When a system is offline, it takes a while to come back on. So the patient is there from early in the morning. Now you have load shedding and sometimes 8 o'clock in the morning. So you start your day now at 10:30, 11. By the time you finish seeing the patient, if you're lucky, you can get blood results. You send them to the pharmacy. Second round of load shedding occurs. What happens then? Patients don't get their medication, come back another day. And for the most vulnerable patient who are taking off an entire day of work or leaving their families and children unattended, this is a significant burden. Then if we look at the quality of care that we're giving, lengths of stays increase in hospitals because scanners are not functioning, times are down, and reporting and getting access to information is absent during load shedding. Another aspect of load shedding is impact on water. And a lot of these hospitals, in particular Charlotte Maxeke, has lots of pumps that are pushing water from lower levels to higher levels in the hospital, and that has an effect. Dialysis machines are linked, and when you have load shedding and you have interruption, these machines go offline. You have blood clotting of these lines happening, and it can compromise patient care. So all the time, we are putting people's lives at risk. We're playing Russian roulette every time there is a load shedding.
Yeah. And how are you dealing with that as Dr. Prof? Are you sending patients away? Do you have that option of sending patients away? How are you mitigating?
As in the rest of South Africa, we're getting quite savvy. When we go to a traffic light now, we know how to work the traffic light and how to get across the traffic light. So this is what we're doing in the hospital. We're becoming more savvy, more aware. But the potential room for disaster is there every single day, every single time there's load shedding. I think we're going to see the generators fail because these were made and installed into hospitals as emergency electrical supplies for power outages. They were never envisioned to be doing the job of Eskom by supplying power continuously. And I think lots of people out in public don't realize that the generators don't supply power to the entire hospital. They're supplying power to certain aspects of the hospital. So there are still areas literally where doctors end up using their cell phone to see patients, to look at results, to make notes. So it is some areas are getting power, lots of areas don't. And we are now installing emergency lamps and into theaters. We're having constant damages to DB boards and overloading of circuit boards. So the potential is there. Length of average stays in hospitals are increasing. And the biggest concern is we are using money for diesel that should be allocated to patients. So the patient care is actually going to be affected in the long term the more money we burn on diesel. 800 to 900 liters on average a day when we have load shedding. That's 5 to 8 million rand a month. And it's not unique to Johannesburg Hospital. Many hospitals are struggling, and at least we have generators. The clinics, district hospitals are actually worse off. They don't have access to a lot of the generator stuff that we have. And all the time, our quality and quantity of care that we're giving to the vulnerable is not anywhere near where we need to be. And I think if we look at the Western Cape, they're off the grid. They are exempt. Why can't we do that where the bulk of patients are, where the bulk of illness is? And Gauteng and the rest of the country needs to. And I'm urging people to get behind the petition to wake up the government, shake the tree, and protect the patients. It could be your mother in the hospital that dies because of an incident like this.
Is there a challenge in the Gauteng province to isolate a hospital like Charlotte Maxeke? I mean, I know it's not the first time, Prof, that you're raising this. You've raised it before.
I think the frustration why I got to a petition is because I don't think the voices of the healthcare workers, the nurses, the unions regarding taking us off the load shedding schedule is being heard. And now we're resorting to petitions, trying to make more public awareness. I do think Gauteng Department of Health is aware and is trying. It's just the frustration of how long must we wait? 1 year, 2 years, 3 years? 1 death, 100 deaths, 200 deaths. It's challenging to know when will we cross that bridge where we can say we are now saving lives. It's not acceptable that we're having this discussion over and over again. The Department of Health, the National Department of Health, and I'm sorry, every single minister should be involved in trying to support me to get us off the load shedding schedule.
We'll talk about the morale in a moment, but let's talk about the challenge of water and infections.
So we know we have hand sanitizers on COVID. We're all familiar with the alcohol in it. But the best modality of preventing infections is soap and water. That's universal. And what we're seeing in our hospital already is a number of new infections. And COVID has also increased that risk, and now we're actually exponentiating this problem by not having the right water supply, the right soap supply, and encouraging the basic functions of hand washing. So all of this is going to impact on patient care, and we're going to encourage antibiotic resistance and the formation of multi-drug resistant organisms. And these are all linked and intertwined. So it's not a simple thing, oh, let's put the lights on. We're talking about longevity of the healthcare system beyond this month and next month. We're talking for the next generations. How do we do that? And you touch on the morale of the hospital. In particular, can you imagine we had COVID, fire, flooding, theft, arson. Back now we have load shedding. And it just does not stop. And we do have a high attrition of staffing, allied staff, nurses who are bearing the brunt of, I think, COVID, a fire, and the load shedding, and they are under immense pressure. And with the financial burden of petrol, resources, I do think we're going to expect and have significant impact on long term in healthcare. We've seen the issues of TB rising. We are in a dire straits with our illnesses, communicable diseases, and patients are coming back from COVID with their chronic illnesses, way worse than what it was before COVID. And we are not able to give the care that we need to. And I want to emphasize to the public, Charlotte Maxeke, Baragwanath Hospital, Helen Joseph Hospital, these are not regional or district hospitals. These are tertiary and quaternary hospitals. So the sickest of the sick, the challenges of the most difficult cases come to these hospitals. So waiting a day or two for a CT scan might not seem such a big hoo-ha. But for that patient who's sitting on the fence of life and death, we're talking significant issues. We are a major cancer center with backlogs for cancer treatment. And these machines we're talking about are dependent on electricity. And if you blow up one of these machines, you're looking at 40, 50 million rands.
To
And
replace.
we know with the 10, sorry?
I'm saying just to replace one machine.
Yes. And we know with the 10-day issues, the wheels of procurement in the government sector take forever. We cry when we need equipment. So it's also a plea to say whatever equipment we have, let's protect it, because we don't get equipment replaced as easily as what people think. Now, let's just write out another check. It takes years to get a machine replaced. Currently, we're sitting with 2 CT scanners that we're still waiting for a tender to be approved. And these have impact on patients' care, both in the immediate and in the long term. And I think load shedding is putting us into a hole that we're not going to get out of if we don't implement something right now. There's lots of issues, but I do think this is a fruit from a low-hanging branch that we can easily resolve if we all say this is a necessity, it's not a luxury. Let's get behind and support the healthcare workers to help the patients. I'm pleading for people to please get behind us and support us in telling the government, stop the load shedding for healthcare facilities.
Prof, I appreciate your time. Thank you very much for coming on. Professor Adam Mohamed is head of internal medicine at the Charlotte Maxeke Academic Hospital.